So we're here to talk about the Mason General Hospital Foundation and its Give Local campaign. And I have two lovely ladies with me, one on each side of me, if you can see, Lynda Erickson and Beth Gregg. And I guess let's first have Lynda introduce herself. Lynda, tell everybody who you are and your role in this campaign.
Okay, my name is Lynda Erickson, and I've been a supporter of the Mason General Hospital and the Mason Foundation for a long time. And I'd like to share a little bit about why I am such a supporter of Mason General Hospital and the Foundation. I think it is very important for all of us to support local health care. And there are, I think, a number of reasons that I would ask you to do that. Probably the most important is the quality of the services we have in Mason County. As most of you know, we have a beautiful hospital facility and new facilities being built. Those are all done with great stewardship on the part of the hospital board, as well as the foundation's money raising, so that in a rural community of modest resources, we have a fantastic facility, and we're making very good use of all of the tax dollars. We also have an exceptional staff, and I'm talking about all of the staff. And the Mason General Hospital Foundation and the board do a lot to encourage and recruit excellent staff to our community. And I think if any of you have been other places and you think you need to see a doctor and you call in April and they tell you that you can't have an appointment till October, you really appreciate the quality of healthcare and services we have in Mason County. And by the way, I've had that experience. Another part of why I would really want all of us to support the Mason County Hospital and the Foundation is what I would call the community of care. And if you've ever gone into the hospital, either for outpatient services or unfortunately had to go in for something a little bit more drastic, what you will find is a lot of the people that work there are your neighbors or people that you went to school with, friends from a variety of clubs. And in addition to the staff assigned to you, they'll stop by and say, gosh, if there's anything you need, either while you're here or after you leave, just let me know, because we really want you to get well. And I know people who have gone to Mason General Hospital who didn't have any friends in the community when they went there. And I can assure you that when they left, they knew they had friends here. And the third thing is maybe a little bit more distance, but I want to talk a little bit about a study that was done in 2006. Commissioner Janie Kamen got Mason County as one of two counties in the whole country, and there's about over 3,000, to look at the economic impact of healthcare in a community. And when the report came out, it was like for every dollar spent in healthcare, there was a $10 impact in the community. And I kind of looked at that and said, I don't think I believe that. But after I read the report, I did believe that. And while it may be a focus for our EDC and our chamber to work with the hospital on it, the reality is that if you spend your healthcare dollars in Mason County, you really do impact the businesses, all the businesses, the small businesses. And that's an important part of keeping the quality community that we've always enjoyed and that we all love. So with that in mind, I'm going to turn this over to Beth, who's going to talk a little bit about the things that we can do to support Mason General and the Foundation during these coming weeks. Beth?
Well, my name is Beth Gregg, and I have been affiliated with the foundation since 2001 when my husband and I retired and moved to Mason Lake and enjoy the beautiful facilities of the lake. And of course, as we get older, we have a tendency to need more doctor visits and have even emergency care. And one thing about having a local hospital and local facility and local emergency room is, this is a wonderful service that is provided. And one of my experiences, and I think I have said this in other interviews, is that one night my husband woke up in the middle of the night with lots of pain in his abdomen, and we went to the emergency room, and there, because of the diagnostic equipment that they had, which has been helped to be provided by the foundation through fund and items and fantasy force. You know, he had state-of-the-art interpretation of his problems, and they diagnosed her because of the imaging, the X-ray imaging. He was diagnosed with 3 aneurysms, and he was taken immediately to Harborview, where he underwent surgery and survived. And, you know, we had a wonderful result. And I say thank you so much to the local facility that helped diagnose that problem. So I have been on the foundation since 2001, have got myself involved in the endowment committee and fundraising, you know, through Fantasy Forest and other events that are sponsored by the foundation. And it's just a wonderful service, and it's something that we need to keep here locally so that we can, you know, I live at Mason Lake, it takes me 20 minutes to get into Shelton, but, you know, if I had to go to Tacoma or Olympia, you know, to see a physician, it just makes life more complicated. But it's just a wonderful facility, and it's just great if we can help to support it. So
I'm sorry, go ahead.
no, I was going to say, do you want me to start talking about the campaign?
Well, I want to get into that, but I wanted to ask Lynda to chime back in here and talk about her experiences with the foundation and the endowment fund.
Well, I have my husband and I don't want to just take all the credit, but Jerry and I have been very involved in the foundation for, I don't know, a long time now, probably 25 years. And there, you know, obviously we've worked on Fantasy Forest, we've worked on the golf tournament, we've written checks, we've asked other people to write checks. It's a great opportunity to support something that means so much to our community. It's also a great opportunity to get to make new friends and to talk about what's really good about our community. So my experience has been exceptionally good over the years. And I kind of am like Beth. I came back in about 2000, but I grew up in this area, and I know how hard it was to get good medical care when we were younger because we were so rural and so small. And so supporting the activities of the foundation, supporting the activities of the hospital and the commission, pairing the county health board with the support of the hospital commission has been a real synergy in terms of getting the most value for our community out of everything we do. A little bit aside, but we were one of the few places, and a lot of places have copied us now, where when John Cruz was doing the food service at the hospital, he prepared a series of healthy menus for people who were getting food from the food banks. So we could increase the community health with the sponsorship of his work at the hospital by having healthy recipes. And as I have talked about that at various forums over the years, there's been a whole lot of communities that hadn't thought of that. And yet it's a partnership. It's a partnership with the hospital and the fire districts. I am a big supporter of the foundation. We've, as Beth mentioned, we've got a lot of equipment that we wouldn't have otherwise if the hospital foundation hadn't worked so hard to target and raise money for specific pieces of equipment that we needed. I know the mammography was upgraded. There was a point at which a prenatal incubator kind of piece of equipment that I couldn't name was purchased as a result. The foundation has done a lot to purchase furniture for families in waiting rooms and areas where during emergency care people are stressed out and it's really hard to be comfortable. So everything that the foundation does that you can't do with regular dollars is a huge value to the quality of care we're able to offer in Mason County.
So Beth, what kind of event do we have going on for the foundation?
Well, right now we have been joined, or I should say, we have joined with the Community Foundation of South Puget Sound. and participating in a Give Local event that is running November 9th through November 20th. And if you make a donation to this Give Local, it comes directly to Mason General Hospital Foundation, and those dollars will be used for different things that the foundation's board has, opted to support. So you can get more information by, following us on Facebook or Instagram or Twitter, or, just going to the website for the foundation. But we would appreciate it if you could, the community would help spread the word and increase the buzz about this opportunity to support locally. So spread the word and just share the news about the campaign for Mason General Hospital, and, with your family and with your friends, giving a personal note as to why you believe in our work and why, you should give or they should give locally. So just spread the excitement and just talk about how wonderful the hospital is and the clinic and, the growth. I mean, since I've been here since 2001, the hospital has grown with the new surgery suite and now with the new Mason Health Clinic, and, just bringing in more physicians to support, our community and take care of us. So, I would like to just say now, if you can help, please do so. It's November 9th through 20th. And just thank you for supporting us in any way that you can, and whatever dollar amount you could support us.
So Beth, do you have an idea of what the hospital foundation would like to fund? What's on the list?
Well, as through the foundation and the endowment committee, which I'm chairman of, we have just voted to support or work with the Bikers for Babies, and they are helping to purchase new equipment for the, I'm kind of like Lynda. I'm not sure what the technical term is for the equipment, but the expense was $36,000 or $37,000. And this Bikers for Babies event just took place, and they were able to raise, somewhere between $6,000 and $10,000 with support of different sponsors. And the pediatric fund under the endowment portfolio is going to pick up the difference to purchase this equipment for the newborn area at the hospital. So, in the past, the funds have been used to remodel the children's portion of the physical therapy department at the hospital. So we've done that in the past, and dollars have been given over the years, to support the new mammography machines. We've gone through all the upgrades and have the state-of-the-art mammography machine. Other than that, right off the top of my head, I'm not sure.
Okay, Lynda, you've been involved in the foundation, so you said 25 years or so. Is there
Yes.
a specific thing that you would like to see that they haven't already funded?
No, but I think that what we've had is exceptional leadership, and the leadership on both the hospital and the foundation have helped to identify the things that are coming along that we need as we need them. And as somebody who has occasion to look at other parts of the country, recognizing that many communities our size are losing their hospitals, they're not able to maintain them. And not only do we have a hospital, we have an excellent hospital, we have excellent staff, and we continue, as Beth pointed out, like with the mammograms, are state of the art. I just encourage the people that are making those decisions to continue to communicate with the community so that we can support and make sure that we stay on the cutting edge of the services we need.
So Beth, I'm going to direct this to you, but Lynda, if you have any insight, feel free to jump in. How does one make a gift to the foundation?
Well, there are quite a few different ways to do that. And I could kind of read them all off. You can always make a donation via the mail. You can go online to the website and give through this Give Local campaign. But after the 20th of November, any support can be done by either just calling the foundation office and, talking to one of the workers there, and they can, take your pledge or take your credit card number and handle it that way. But there's also an opportunity that would really help the endowment fund to, support in perpetuity all activities of the hospital, in that when you make a donation to the endowment, that would be included to the principal, which then generates interest and dividends, which we give each year back to the hospital to purchase equipment. So last year at Fantasy Forest, we were able to give them a check for $25,000. And the year before that, we gave them $15,000. And one of the things I got so excited about was about 3 years ago, we finally reached our $1 million mark with the endowment fund. So it just gives us that opportunity to use those interest and dividends to support. Our goal is, and our pledge is, that we never touch the principal, but we do take the interest and dividends to support the purchase of new equipment or whatever activities that the board votes to do. One of the things we talked about last year and we passed a $6,000 donation is to support the car seat program in Mason County, where they do educational classes and give car seats to newborn parents with newborn children that, don't have the opportunity to get a car seat, which, is just a totally necessary piece of equipment. We're also planning to help do some remodeling of the new physical therapy department for the children's section, which we did in the old hospital, but now we'll have to redo that again and upgrade. So you can give a state gift or include us in your will. So a charitable request in your will is one of the simplest ways to provide a generous donation to the endowment fund. And those dollars are going to be used to help support the hospital, forever. So you can do lots of different things, give gifts of stock, or you can also bequest or designate the foundation with a life insurance policy, include us in your retirement plan or a trust or, a charitable trust. But those things you need to talk to either Jen at the foundation office or, your family estate attorney.
Let's talk about a little bit about the IRS. And this is IRS, it's tax deductible, right?
Right. So, yeah, the foundation is a 5031C. Is that what it is?
501c.
501c3.
Okay. It's all the numbers.
Yeah, it's all the numbers. But no, any contribution to the foundation, according to the rules that are in place, like right now, you could give up to $10,000, I think, which is deductible. But those are all things you would have to talk to your accountant and your attorney to make sure that it works, with your individual situation.
Just one other tiny thing I would add is it's been kind of a tough year, and some people don't have as much money as they might during a normal year. And I would recommend that they call Jan and talk to them if they really want to be helpful to the foundation or the hospital. She probably has some ideas, some ways that people can help out during this transitional time until we all get back on our feet.
Beth, tell us about the IRS and what's this CARES Act?
Right. Because of COVID-19, the IRS has, and I'm not sure if it goes on after 2020. But for 2020, the IRS has decided to allow taxpayers to claim standard deductions while also permitting you to take a credit for up to $300 in a cash-based charitable contribution made during the year to a 501c3 organization like Mason General Hospital Foundation. So, that means if you don't itemize, you can still take this $300 deduction as long as you've made a cash contribution. So it helps everybody, whether it's just the hospital or if it's your local church or, any other entity. But it's just something that was passed in the CARES Act.